What if your body had been warning you about diabetes every single day, and you simply didn't notice? Even before any blood test is done, even before a diagnosis is made, the signs may already be clearly visible on your feet. And what I'm about to show you today could completely change the way you look at your health. Most people believe diabetes can only be detected through a blood test. You go to the doctor, get your numbers checked, and only then do you learn the truth. And I understand why so many people think that. For years, patients have told me exactly the same thing. Welcome to Gesund ab 65. I've been practicing medicine for over 20 years, and one thing I've learned, one thing I continue to see confirmed week after week in my clinic, is this. Your body often begins warning you about high blood sugar long before any lab result ever appears, and the very first place your body often sounds the alarm is in your feet. The reason I'm making this video today is simple. I've seen too many patients come into my office, or worse, the emergency room, after having warning signs for months, sometimes even years, without realizing what those signs actually meant. Today, I want to change that for you. Just last month, I sat across from a 67-year-old man. Retired, healthy lifestyle, felt fine overall. He came in for nothing more than a routine checkup. But even before we drew blood, I asked him about his feet. He said to me, "My feet have felt a little numb for a while. I thought it was just aging." He had 4 of the 9 signs I'm going to show you today. His fasting blood sugar was 214. He had diabetes, and most likely had been living with it for more than 2 years, without knowing it. So today, I want to show you exactly what I showed him. 9 warning signs already visible in his feet. Signs that may also be showing up in millions of other people right now, without them understanding what they mean. And for each of these signs, I'm going to explain what most people mistakenly assume, what is actually happening inside the body, and one simple daily habit that may help protect you. The American Diabetes Association estimates that 1 in 5 Americans with diabetes doesn't even know they have it. That's more than 8 million people living right now with a silent disease that may slowly damage their nerves, kidneys, eyesight, and yes, their feet. The good news is this: a simple blood test, often costing around $12, can detect diabetes early. But before you get tested, you need to know what to look for. So let's begin. Sign number 1. Tingling, numbness, or that pins and needles feeling in your feet. Almost every patient I ask about this has experienced it at some point, and almost all of them brushed it off. Many tell me, "Dr. Ben, my foot just falls asleep sometimes. I probably sat too long with my legs crossed." And yes, that can happen to anyone once in a while. But I always ask, does it happen regularly, without any clear reason? And if the answer is yes, then we need to talk about what may really be going on. Frequent numbness or tingling in the feet, what doctors call peripheral neuropathy, is one of the earliest signs that blood sugar may have been elevated for quite some time. Excess sugar in the bloodstream begins attacking the protective outer layer of your nerves. This process happens slowly, and that's exactly why so many people miss it. I often explain it to my patients like this. Think of your nerves as electrical wires. Every wire has a plastic coating around it. That coating keeps the signal traveling clearly from your brain all the way down to your foot. When blood sugar stays high for too long, it's like acid slowly eating away at that insulation. The wire may still work for a while, but the signals become distorted, blurry, unreliable. And that blurry signal is what you feel as tingling. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes. It is the most common complication, and it almost always begins in the feet. That means millions of people are feeling this exact tingling and assuming it's nothing serious. Please don't make that mistake. My daily recommendation for anyone over 60, walk for 20 to 30 minutes every single day. No jogging, just walking. Movement improves blood flow to the feet and helps protect those delicate nerve endings. And cut back on added sugar in your diet. Not next month, but today. Sign number 2, burning soles of the feet, especially at night. Many of my patients describe this as one of the most distressing symptoms of all, because it doesn't torment them during the day. It shows up at night when they're lying in bed with nothing to distract them. A lot of people blame it on being on their feet too long, summer heat, or simple exhaustion. And sometimes that is true. But when a patient tells me, "My feet feel like they're burning, especially at night," I take that very seriously. Burning feet, especially at night, are a classic early sign of diabetic neuropathy. So what's happening? The nerves in the feet have been damaged by excess sugar and begin sending false signals to the brain. The brain receives the message, heat, even though nothing hot is touching the foot. The nerves are misfiring. Imagine a smoke detector with a damaged sensor. The building isn't on fire, but the alarm keeps going off because the sensor is broken. That is exactly what happens in the nervous system. The burning doesn't come from outside. It comes from damaged nerve tissue crying out for help. Research published in Diabetes Care shows that burning foot pain is often one of the first symptoms reported by patients who are later diagnosed with type 2 diabetes, sometimes 1 to 3 years before the actual diagnosis. So here are my 2 recommendations. First, drink at least 8 glasses of water a day. Good hydration helps the kidneys flush excess glucose from the body and supports healthy nerve tissue. Second, add more fiber to every meal. Vegetables, beans, oatmeal. Fiber slows the absorption of sugar into the bloodstream, and that is exactly what these damaged nerves need. Sign number 3, small cuts, wounds, or blisters that just won't heal. Now we're getting into dangerous territory, because this sign is not just uncomfortable, it can become serious. Patients often tell me, "Dr. Ben, I had a small blister from my shoe 3 weeks ago. It still hasn't healed." They waited. They assumed it would go away on its own. And yes, small wounds often do heal on their own, but not when blood sugar has been high for too long. When your blood sugar remains elevated, your body begins to lose its ability to heal efficiently. Blood vessels throughout the body, including the tiny ones in your feet, become narrower and stiffer. That means oxygen, white blood cells, and vital nutrients can't reach the wound quickly enough. So the wound stays open, vulnerable, slow to heal. Think of it like trying to water a garden with a hose that has a sharp kink in it. The water is there, but it can't get where it needs to go. That's what high blood sugar does to circulation in your feet. And an open wound that won't heal is an open invitation to infection. The Centers for Disease Control and Prevention report that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States. More than 100,000 every year. And almost all of them began as a small wound that was ignored. So here is my advice for tonight. After your shower, sit down and look carefully at both feet, between every toe, under your heels, along the sides. If you notice a cut, blister, or broken skin, clean it gently with mild soap and water, treat it with an antiseptic, and cover it. And if it does not improve within 48 hours, call your doctor. Not next week. Within 48 hours. Sign number 4. Discoloration around the feet and ankles. This sign often hides in plain sight. Most people see it every day and still don't realize what it means. Patients tell me, "I think it's just sun damage," or "My ankles have always been a little darker." And sometimes that's true. But there is a very specific pattern of discoloration, especially around the ankles, that I watch for when I'm assessing the risk of high blood sugar. When circulation is impaired by elevated blood sugar, the lower legs and feet don't receive enough fresh, oxygen-rich blood, and the skin begins to change color. You may notice darkening, deep redness, or even a bluish tone around the ankles. That is a visible signal that blood supply may not be adequate. In some patients, the skin in that area also becomes thinner and more fragile, another sign that the tissue isn't being properly nourished. I explain it like this. Your blood is like a delivery van carrying oxygen and nutrients. Your feet are at the very end of the longest delivery route in your body, farther from the heart than almost anywhere else. If the roads become narrower because of damaged blood vessels, those deliveries arrive late or stop arriving altogether. And the skin responds by changing color. A study published in the Journal of the American Academy of Dermatology found that these skin changes may appear an average of 18 months before an official diabetes diagnosis. So here is the daily habit I recommend. Spend 5 minutes every morning doing simple ankle circles, toe lifts, and calf stretches. Even this small amount of movement can help push more blood into your feet. And if you're not able to move very much, try elevating your feet slightly while sitting. Even that can make a noticeable difference. Sign number 5. Dry, cracked heels that never seem to improve. This one surprises my patients the most. Because it looks harmless. Dr. Ben, my heels crack every winter. It's just dry skin. I hear that all the time. And yes, it's very common. But if your heels are cracking badly in the middle of summer, or no cream in the world seems to help, then we may be dealing with something else. Diabetes can damage the autonomic nerves, the nerves that control automatic body functions without you even thinking about them. One of those functions is regulating moisture and sweat in the skin. When those nerves are damaged, the sweat glands in the feet stop working properly. The feet begin losing their natural moisture from the inside out. And no lotion in the world can fix the real cause if that's what's happening. Think of your skin like a brick wall that needs to stay sealed. When the autonomic nerves are damaged, it's as if the mortar between the bricks begins to crumble. Cracks begin to form. And those cracks are not just a cosmetic issue. They are open doors for bacteria and infection. I've seen patients whose heels were cracked so deeply they were bleeding. And for 2 years, they had done nothing but apply lotion, with no real improvement. At that point, it's no longer just a skin problem. It's a nerve problem. The American Podiatric Medical Association lists chronic, hard-to-treat heel cracks as an important clue pointing to autonomic neuropathy in older adults, a condition directly associated with long-term high blood sugar. So here is my advice. Apply foot cream every night before bed. A good foot cream, or even pure coconut oil, can help. But here's the important part. Only apply it to the soles and heels, never between the toes, because trapped moisture there can encourage fungal infections. And drink enough water. Your skin needs hydration not just from the outside, but from the inside too. Now I want to pause for a moment and ask you something directly. Have you ever noticed any of these first 5 signs in yourself, or in someone you love? Your spouse? Your mother? Your brother? If the answer is yes, even if it's just one sign, make a mental note of it. Because that is how awareness begins. And that is how prevention begins. And if you're finding this information helpful, remember this above all. The earlier you recognize these warning signs, the more you can do to protect yourself. So let's keep going. Sign number 6, swollen feet and ankles. This sign is more serious than most people realize, because it may not just involve your feet. It may also involve your kidneys. Almost every patient with this problem first says, "I sit at a desk all day," or "I'm on my feet a lot for work." And yes, occasional swelling from sitting or standing too long is normal. But if your feet and ankles swell regularly and your socks leave deep marks by evening, then we may be looking at something else. High blood sugar can damage the kidneys, and the kidneys regulate fluid balance in your body. When they've been under strain from excess glucose for years, fluid begins collecting where gravity pulls it most, your feet and ankles. This swelling is called edema. Think of your kidneys as a filtration system. Every drop of blood passes through them to be cleaned. If high blood sugar damages those filters, the whole system begins to back up. Extra fluid is not removed properly, and it settles downward. If you press your finger into the swollen area and the dent stays visible for a few seconds, that is called pitting edema. And that is not something you should ignore. The National Kidney Foundation reports that about 1 in 3 adults with diabetes develops diabetic kidney disease. Swelling in the lower extremities is often one of the first visible signs. So what can you do? When resting, elevate your feet above heart level. Even a small pillow can help. And reduce the amount of salt in your diet. Too much sodium causes your body to hold on to water, and that makes swelling much worse. If the swelling is new, persistent, or getting worse, please bring it up at your next doctor's appointment. Don't wait until it becomes something bigger. Sign number 7, sharp, stabbing, or electric pain in the foot. This is the sign I see misjudged more than almost any other. Especially men will often tell me, "I've been taking ibuprofen for months for this foot pain. I thought it was arthritis or an old sports injury." And sometimes that's exactly what it is. But sometimes it's something very different. Something ibuprofen does not fix at all. When nerves are damaged by long-term high blood sugar, they don't always go numb. Sometimes they become overactive. Instead of becoming silent, they begin sending sudden, intense, random signals to the brain, and the brain interprets them as severe pain. Patients describe it as stabbing, electric, like a hot needle in the foot. And it often becomes worse at night, when there are no other distractions. Imagine a car alarm system that was damaged in a minor accident. Every few minutes, it goes off even though nobody is touching the car. Not because there is real danger, but because the system itself is malfunctioning. That is exactly what a damaged nerve does. The pain is absolutely real. But the cause is not an injury. It is a malfunction in the nervous system. And ibuprofen does not repair a damaged nerve. At best, it may only mask a signal your body is urgently trying to send you. A well-known study in the New England Journal of Medicine found that painful diabetic neuropathy affects about 25% of people with diabetes and is often mistaken for arthritis, tendonitis, or age-related joint pain. So here is my recommendation. Every morning, before you even get out of bed, spend 5 minutes doing gentle stretches for your feet and ankles. Point your toes, rotate your ankles, gently pull your toes back. And in the evening, before sleep, give your feet a gentle 3-minute massage. Small circular motions along the soles and up toward the ankles. Your nerves will thank you for it. Sign number 8, constantly cold feet, even in summer. When I see this sign in a patient, I know the issue may no longer be in the very earliest stage. Almost everyone says the same thing first. I've always had cold feet, Dr. Ben. And then I ask, even in July? Even under 3 blankets? Even when the rest of your body feels warm? Because that is when I pay close attention. Feet that stay cold regardless of the weather. In summer, under thick blankets, even when the rest of you feels warm, may be a strong sign that circulation to the lower extremities is significantly reduced. The blood vessels have narrowed or hardened, and warm blood is no longer reaching the toes properly. Think of it like a home heating system that is supposed to send warm air to every room. If the ducts become narrowed, the heat no longer reaches the farthest rooms, and those rooms stay cold, no matter how hard the heater works. That is exactly what can happen in your feet. At that point, the cold has less to do with the weather, and much more to do with your blood vessels. The American Heart Association notes that peripheral artery disease, narrowed blood vessels in the arms and legs, affects more than 8 million Americans, with diabetes being the single biggest risk factor. So here is my best recommendation. Walk briskly for 30 minutes every day. Not a slow stroll. A purposeful, slightly faster walk with active arm movement. That kind of movement helps push blood down into the lower legs and feet, strengthens the blood vessels, and over time may help improve early narrowing. And if 30 minutes feels like too much, start with 10. The important thing is not perfection. The important thing is to start today. Sign number 9, hair loss on the lower legs and tops of the feet. Almost no one talks about this. It's barely mentioned in most patient brochures. And most people walk right past it, sometimes even doctors. But once you know about it, you won't overlook it again. When I examine the feet, I also pay attention to the lower legs and the tops of the feet. Sometimes I notice that there is visibly less hair growing there, or no hair at all. The patient looks down and says, "You're right, I never noticed that." And that is exactly the problem. It is a silent sign, easy to miss, but deeply meaningful. Hair follicles need a steady supply of blood and oxygen. When circulation has been impaired for a long time by high blood sugar, those follicles stop receiving what they need. And over time, they stop producing hair. So this type of hair loss is actually a visible sign that blood vessels may have been damaged for a long time. Think of hair follicles like small plants in a garden. If the irrigation pipe becomes narrow or clogged, the plants don't die all at once. They simply stop growing little by little. And that is the key point. The absence of growth is a message in itself. Research published in Diabetes, Obesity, and Metabolism shows that hair loss on the lower extremities is strongly associated with peripheral vascular disease in people with diabetes, making it a sign doctors specifically watch for. So here is my advice. Take a look at your lower legs and the tops of your feet today. If the hair there is noticeably thinner than on other parts of your legs, or missing entirely, schedule a blood sugar test this week. Not this month, this week. A simple test can completely change the course of your health. Final thoughts. We covered a lot today. 9 signs. 9 opportunities to notice something before it catches up with you. And I want to be completely honest with you. One of the hardest moments in my profession is sitting across from a patient who has had these warning signs for 2 years and is only now learning what they meant. Not because they didn't care, but because no one ever gave them the information. Now you have that information. And tonight I want you to do just one thing. Sit down and look at your feet. That's it. Just 30 seconds. Look at the skin. Look between the toes. Notice any numbness. Check for wounds that shouldn't be there. Just 30 seconds. And if you notice anything from this list, anything at all, please call your doctor tomorrow. Not next week, tomorrow. Because the earlier diabetes is detected, the better it can often be controlled, sometimes through changes in diet, daily movement, and a timely conversation with your doctor. You have worked hard for your life, for your independence, for your health, for your ability to keep doing the things you love. Don't let something as manageable as high blood sugar take that away from you, simply because no one told you what to watch for. Now you know. And if you found this information helpful, please share it with someone you care about. A family member, a friend, a neighbor. You may be giving that person exactly the information they need right now. And if you want more conversations like this, I publish a new video every week on this channel about the health topics that truly matter after 60. Things I talk about with my patients that most people never hear outside a doctor's office. This is Gesund ab 65. Stay alert, stay proactive, and take good care of your feet. I'll see you in the next video.